They're here with another video. I just did that baby video, which hopefully you see sooner and later. And now we're here with Bonnie today. She is married to an old friend from high school. I've been treating her son for about 3 weeks now, 4 weeks, something like that. Michael, he's the football player, 16-year-old that looks a little older than 16 years old.
Yeah, I know.
A little bit. She's been begging to come in. She wanted to get her son worked on first. Now it's her day. She's excited to be here, and we're going to get her better. So we're going to go over some of her symptoms here. You're here primarily because your back hurts, right? And your head hurts. So tell us a little bit about that.
Ouch.
Ouch? Is that as bad as it gets?
It's actually within the last couple weeks I can move and I feel like I'm gonna pass out. There's some. It goes from a 7 to a 10, like. And
when is it worse, in the morning or evening?
Usually the morning when I'm first getting moving in the morning, and then I try to take a couple laps up and down the driveway to get
loosened up.
Loosened up.
So how long have you had this pain?
Off and on 20 years.
20 years. And how many chiropractors have you seen?
Just one.
Just one. And he helped you out way back when?
He did.
Yes, gotcha. And so she hasn't been to one in how long? I don't remember how long since you've been to one.
It's been over 10 years.
10 years. And what's bringing you in now? You thought you were kind of dealing with the pain, and now it's just gotten so bad.
Well, yeah, it would come and go. Like if it would go out, and then I could just wait a few days or get some anti-inflammatories and wait for the swelling of the nerve to go down, whatever, and then I would be okay. But this time it's just
relentless.
Relentless.
Yeah. Gotcha. And so something you did that always makes me laugh, people do this, is when you're in bed, what do you do to relieve the pain? You put your legs up on what?
On a pillow.
On pillows, right? You put it under your knees or under your legs, right? Okay, and that helps with the pain, right?
Right.
Okay, has that made the pain go away?
No.
No, it doesn't make the pain. It's terrible for you people to do this. It actually makes me harder. It makes it hard for me to fix you in the future. What else do you do with? You put it on your legs. You lay on the floor and you put your legs up on a chair, right?
Yes.
And it feels good when you're doing it, right?
It does.
But does it help take away your pain?
It doesn't help when I'm getting back up off the floor.
Yeah, it's absolutely the wrong thing to do. Everybody out there, physical therapists, the medical doctors, even you chiropractors keep telling patients to do this stuff. Terrible for your backs, okay? Symptomatic relief is not fixing the cause. That's the problem there, okay? So, anyways, let's move on. A couple times a month, you get some swelling between your shoulder blades here.
Absolutely. It feels like a water balloon.
Feels like a water balloon.
It just is squishy.
And again, a lot of people know on videos is that this water balloon feeling is because her posture is so bad that it gets to a point where she leans forward so much that her back actually swells up with injury. And it happens a couple times a month, okay? 5 years ago, you had what? The ears, double ear.
Oh, double ear infections. They
Yeah.
told me it was from allergies, and
Do you have allergies?
Never had allergies my whole life.
Okay.
So
And over the last 5 years, you said you've had 3 episodes.
Yeah.
Back and forth through your ears, really severe ear infections. It ain't an ear infection.
And they feel full, like. Yeah. They don't always get to the point of infection, but they feel like they're full of fluids and like I'm talking underwater. Yeah. My son said, I can't hear you, I can't. And to me, it feels like I'm yelling because of the
fullness.
Yeah,
what it is the atlas or the neck is so tight that it's cutting off the eustachian tube. So the equalization of pressure, when you guys are on airplanes or in mountains and you try to blow it out,
like, exactly.
It feels like that all the time. Well, that equalization doesn't occur because the neck is so tight. So long-standing imbalances, long-standing pressure on the neck will cause this. And so, yes, she may have a symptom of an ear infection, but really it's just massive tightening of that eustachian tube. Other thing. Last 3 years, you've had irregular cycle too.
Absolutely.
Tell us about that.
Yeah, I'll not have a period for several months and then have one for a month. And it'll just be relentless.
The reason I'm pointing that out is because that's a neurological function too. She says there's some organic problems that could be possible with that, and it's always possible that something else could be happening, but I have seen it so many times that irregular cycle is attached to long-standing pinched nerves. So I just wanted to point that out as a symptom. And lastly, go ahead and check your shoulder. Lift your shoulder up. And where do you feel the pain right now?
Right.
And how long has that been going on for? A year and a half. So she can't lift it up now. I'll lift your right arm to show the difference, okay? Look at, see? She has a funky chicken really well over here, but the no funky chicken on this side. Okay, so lots of pain right there. So we're gonna adjust her. Anything else you wanna add? Nope. Okay, so let's get her adjusted. Glasses off, please. Right here. Go ahead and lay on your back over here. Big step.
Okay.
Take your time. You want to use a table to bring you down?
I'm almost there.
Good. Go and scoot down a little bit. Good. Fingers on your belly like this. Yeah, on your belly right there. Okay. So she's seen her son adjusted many times, and so she's ready for this. We have never adjusted you, right, Bonnie? Gotcha. So most important thing, again, Bonnie, is just relax the best you can, okay? And you haven't done this for 10 years. We'll be as gentle and easy as we can, okay? She already totally trusts me because she's seen what I've done with her son. But, oh, by the way, the x-rays, you'll see those in a second. They're popping up right now. You see that massive hook osteophyte off the bottom of her lower part of her neck? That's not the cause of her problem, that's a symptom of the problem. That shows you how much pressure is in her neck. So check that out. Good. Feel that pressure in there?
Mm-hmm.
Okay, which side's worse, right or left?
That's hard to...
About the same?
That's the same.
About the same? Okay. Okay, we're going to give you your first adjustment here. Okay, come a little closer, please. Good. Right in here, we're going to this way, down in here. Okay, let's go. Good. You okay?
Mm-hmm.
Good. That hurt a little bit? Or
Mm-hmm.
Okay. Did you feel it when I adjusted it? It actually came back. It went in and then went out again.
Mm-hmm.
Yeah. Okay, let's see. So what I mean by that is as I adjusted her, the adjustment went okay, but there was so much tension it actually popped back out. Still gonna be better than it was, but that's how much pressure's in her neck.
Oh, Lordy.
Good. That one hurt more or less than the right side?
A little bit more in a different
way?
Yeah.
Gotcha. Come back around, please. So, Bonnie, just like I've told your son a million times, no twisting or turning when you get up, right? You're gonna look straight ahead, no putting your hands back in your hips. Let your hands stay at your side.
Mm-hmm.
Okay. Now, this should feel a little less pain than it was a few minutes ago, right?
Mm-hmm.
Or even a minute ago, how long it was?
A little.
A little bit less, yeah. Okay. Okay, and every hand. Help you up here. Now let's use a table.
Use the table.
Okay. Now, you're gonna take a big step down. So right now you're standing on the pad, so don't just walk off. Let's get a big step to take down. Stay right there a second, stay right there. It's a big step on every hand. I'll help you down. You got it? Good. Then you come walk around the back of the table here. How dizzy are you, kiddo?
A little bit.
A little bit? Good. Keep your shoulders down. Good. Now you're going to walk to the front door. Watch your step here.
I'm walking.
You're walking. Shoulders down. Slow, deep breaths, please. Okay, relax those shoulders. Kind of wiggle those arms out. Good. Don't look down at the ground. Look straight ahead. Come on back. Good.
Ooh, I'm popping.
Breathe in and out. Slow, deep breaths. Lightheaded still?
Mm-mm.
Okay, one more lap, please. Okay. You're already feeling different. I can see it the way you're walking.
Mm-hmm.
Yep. Am I putting words in your mouth?
No.
Come back. You're gonna stop right out here. We're gonna check you out over here. Okay. Slow, deep breath again. Relax your shoulders. Don't look down at the floor. Now, without even moving anymore, do you feel any different?
Yes.
What do you feel different, just off the top of your head?
Oh, just like pressure relief. Like.
Where is the pressure relief? I'm curious. Just what you're feeling. I'm curious.
Feels like there's 20 pounds off my shoulders, just like 20 pounds lighter.
Cool. Okay. So let's check your back now, okay?
Okay.
Okay, so I didn't do this in the video. Sorry, guys. I'll have to check it now. I forgot to do the pre and post check. I got so sidetracked. Okay, so let's touch your toes. Let's go ahead and go down. Okay. Okay, go ahead and stand up. Still lots of pain there, right?
Lots of pain here.
Gotcha. And what does that feel like right now? 6 or 7 or 2 or 3? Where do you feel you're at?
6, 7.
Okay, that's fine. Now go ahead and go back. Good. Go ahead and stand up. You don't have to show off anymore. That would be better than normal, right?
That's better than normal.
Okay, so we're going to do one more thing on you. Stay right there. We're going to try to make your low back a little bit better. You're going to sit right in this chair, please. Go ahead and come to the chair. Good. Okay, I'm going to push down on your shoulders here. Can't believe I forgot to do the pre and post. Getting so used to these videos, I forget to do it sometimes. Sorry, people. Okay, slow, deep breaths. You feel this down your shoulders, up into your neck?
Actually, right here.
Right in your back. But isn't your pain on the left side? Or your sciatica, or is it the right side?
Right now, it's right there.
No, but usually it's on the left, right?
Yes.
Okay, gotcha. Slow, deep breath. She says she's pointing to her low back when I'm pushing here. Good, one more breath. Good. Lower your shoulders. Good. Good. You do a couple more laps here for me in a second. Good. Now go ahead and walk again.
Oh, wow, that was easier.
Yep. Okay, walk to the front door, please. That one should have made you a little lightheaded. Relax the shoulders.
I'm trying.
Yeah, just but try to let them, shake them out a little bit. There you go. Don't look at the ground. Look straight ahead. Good.
I don't feel like I'm teetering anymore.
You aren't. Turn around. I said the same. I was thinking the same thing. You're not wobbling. One more lap and we're done. We'll come over here and check you one more time. Relax those arms. There you go. You're going to stop right here. Take your time. You're going to touch your toes again. Now, how's that 6 out of 7 pain in your back now?
A little bit better.
Go ahead and stand up. How much better is that? Was that a 4 out of 10 or 3 out of 10? It's not a 6 or 7 now.
No, it's 4 or 5.
4 or 5? Okay. Good. Go ahead and go back one more time. Good. That's way better than it was a minute ago, too. Good.
Yeah, that one feels way better.
Thanks, Bonnie. I appreciate the video.
No, thank you.
See you guys. Hi, Bonnie.
Hi.
How are you doing today? This is your, how many treatments have you had? This is your third one?
Third one.
Third treatment here. And you came in ridiculous pain for a long time, 20 years of low back pain, sciatica. How are you doing today? How much better is your back?
Oh my gosh. A million times better.
Million
It's hard
times
to
better.
explain.
Hard to
I
explain.
can move.
Gotcha. And what have I adjusted on you?
My neck.
And what did you come in for?
My back.
Okay, just curious. Just want to make sure. I haven't adjusted anything else but your neck, right?
No, that's right.
Gotcha. And you came in, the first thing out of your mouth this morning was what? You slept.
Like a baby.
Okay, when's the last time you slept that well?
Years.
Years.
Probably, and I probably had meds to help me sleep when I did.
You told me in your exam, in your history, that you used to wake up 3 to 4 times a night.
Absolutely.
How many times did you wake up last night?
Once, because I had to go to the bathroom.
That's
about it.
And you said also the dogs jump in bed with you and they bother you all the time. And what happens with there? Just tell me that little story real quick.
Well, when they get in bed with me, then I wake up and then I can't find a comfortable place to fall back to sleep. So I'm up half the night trying to find a way to sleep.
Did the dogs stay out of bed with you last night?
No,
and
never.
And they jumped in bed. What happened?
I just kind of just said, okay.
Just sleep, do your thing.
Do your thing.
Gotcha. Now, you're not completely out of the woods, but you're feeling a ton better. You tell me about the shower this morning. You had a little bit of pain when you're trying to wash your feet.
Yeah, I had a little spasm in my right lower back.
But we said there's a positive aspect of that, is that when's the last time you tried to even clean your feet with your hands?
It's been a while.
So you said normally you used to just throw a washcloth on the ground and clean them, right?
Yep.
Okay, so again, still work in progress, but one last thing. What was the other thing too? Slept better. Oh, I know. I want to talk about the curb. When you walk down the street, you said you used to do what?
I used to go up to the driveway side of the curb so that it would be flat and I wouldn't be tilting at all.
Because the tilting did what?
It would spasm.
Yeah, and so now what are you doing when you're walking down the street?
I just walk.
You just walk down the side of the street?
Just make sure my shoulders are down
Yeah,
and my head
good
is
girl.
up.
So you're learning what we're talking about.
And looking straight and just walk.
And you're feeling much better. I appreciate you coming in here and giving me this little testimonial. And we're going to keep getting you better.
Absolutely.
There you go. Bye.